No medicine can remove the cause of a lifestyle disease, but you can. Welcome to Lifestyle Disease Doctor. Here we bring you evidence-based conversations on various chronic lifestyle diseases. Today's topic is liver disease and fatty liver disease. Basically, we have divided it into 4 parts so that it is easier to absorb for those who are keen on it. In the first part, we look at the nature and cause of liver disease, especially fatty liver disease. In the next part, we look at various treatments available at present in these fields. In the third part, we look at the various comorbidities and complications associated with liver disease and fatty liver disease. And in the fourth and final part, we see how clinically supported lifestyle correction can play a major role in treating these diseases. With us, we have today Dr. Jolly Thomson, who has extensive experience in treating patients with chronic lifestyle diseases like liver disease and fatty liver. The first question to Dr. Jolly is, what are the various liver diseases?
Liver disease is mainly of two types. One is acute and then the other is chronic. Acute means the disease has a fast progression and the patient will get a symptomatic within a few days or even within weeks. And in chronic type, it is slowly progressing and the patient will not knowing about it for a long time, maybe years, 10 or 15 or 20 years. There will not be any symptoms. Only we will be able to find out it by the testing. The modern diagnostic test we will be able to find out. In the acute, most common is viral infections. Actually, infections can give an acute liver problem, or the drugs, some antibiotics or chemotherapeutic agent. Even some patients, it can create liver failure within a month or very fast. So that is why when we give medication, especially liver toxic medicines, we'll check the liver function test even every week in the initial stage. When it comes to chronic disease, it is the one is we all know that alcoholic liver disease, and next is non-alcoholic liver disease and non-alcoholic non-alcoholic hepatitis NASH actually. And it can progress to fibrosis and then cirrhosis and then to liver failure or even carcinoma of the hepatocellular carcinoma.
When we talk about fatty liver, it seems to affect almost 1 in 4 adults world over. Yet, people generally feel that, fatty liver is something very light because initially, everyone says, oh, it's okay, you can manage it and all that. What exactly is fatty liver and what should patients know when they get a diagnosis of fatty liver?
Fatty liver means simply accumulation of fat in the hepatic cell. At a cellular level, fat is accumulating. While fat is accumulating, the liver is not able to handle the fat coming into the liver. That is what we are eating. It is from the intestine. It is directly absorbed into the blood and coming into the portal circulation. That is, it is going into the liver and it gives the whole food you are eaten. It is absorbed and it is given to the liver for processing. But the liver is not able to process it, or the carbohydrate, if you have taken excess, it will be converted to fat by the liver, but it cannot give and send it for storage. The storage will be full, or the fat or it is not able to process it into energy form or other products like whatever is like cholesterol and all is made from the fat itself. So such production is blocked, then the fat will accumulate, that is creating problem for the cells, and then it will, if it is accumulation is too much is there, then it is hepatitis, the cell itself will get damaged. That is a major problem actually in the fatty liver. In the initial stage, there will be only micro vesicles or micro level accumulation, but when it is going to stage 2 and stage 3, etc. The cell damage, and that is leading to the fibrosis and cirrhosis and liver failure, etc.
You often say that, in our body's organs, they are supposedly so prepared that, up to around 70 or 80% damage they can sustain and, give a feeling of being normal. So in the case of this liver also, the same problem seems to happen, that lot of damage can be sustained by the liver, and the person thinks that everything is normal. So what is the way in which patients can be made aware that, that if they continue in this way, within a couple of years they can face serious problems?
Basically, liver forgives a lot. And if it is this fatty liver and this chronic problems, it will continue. You will not be symptomatic at all. You will not be feeling, we may be feeling a little tiredness in the initial stage. Actually, there will not be in stage 1 or stage 2 fatty liver if there is no other disease. There will not be any problem actually. Only if you have diabetes or hypertension, and along with that, if you are taking so many medicines, then you may feel abdominal discomfort or abdominal pain and all may start. Otherwise, it will not show any symptoms. And if you are not looking for the blood test routine health checkup only, you will be able to find out there is a fatty liver or the liver is shrinking. So what we have to do, you should look for it. And the end stage, when the end stage comes, you may get edema or the ascites can occur, or with portal hypertension. Portal hypertension means inside the liver there is a circulation. Actually, generally we call hypertension is the systemic circulation. We have other two circulation. One is the liver circulation specific for the liver, that is called portal circulation. And if the pressure increases in that, there will be varicose veins inside the esophagus, inside our food pipe, and it can break and bleed, and that is it. That is the end stage. The patient come with vomiting blood. Just like the leg varicose veins rupture, it can also rupture, and then that is actually we call it vomiting blood, and then that stage only some patients will be aware of their problem. But we can find out all this very early stage itself actually, with if you are looking for it.
If that is so, all patients would like to know what are the major risk factors that they should be aware of, so that they can actually prevent this situation.
Everyone knows that the alcohol intake. Alcoholic damage the fatty liver, and then goes to alcoholic hepatitis, fibrosis, cirrhosis, and failure or cancer. The next is the non-alcoholic fatty liver and liver damage. Actually, alcohol is a carbohydrate, just like the other our rice and wheat and the regular food. So if the carbohydrate content is excess, that also, if you are eating too much of carbohydrate, it will be converted to fat by the liver, and it will be sent for storage in the adipose tissue, that is the fat cells inside the abdomen and also the subcutaneous area. And actually everywhere there is a fat deposit. Every artery and nerve is covered, the passage is through the fat actually. That is a protective cover will be there everywhere. So this will be get accumulated, and it is be overcrowded. If there is a limited, fat cells are limited in our body, and it can expand, just like your tummy is expanding. That is, when you are seeing an expanded tummy, your belly is protruding. That means there will be definitely you will be having fatty liver also, because the excess fat in your body, it will be trying to find out deposition in different places, and if there is a tummy, protruding tummy, you will be having a fatty liver, and also you will be having atherosclerosis. Your blood vessels will be get blocked with this. That is actually this. We are doing the stent for the heart, coronary artery and all, because of the fat accumulation, which is creating problem and block. this will be happening. This all actually is a parallel thing. So it is called metabolic syndrome actually. This it's a fatty liver also is a part of the metabolic syndrome. Obesity, hypertension, diabetes, and dyslipidemia. The triglyceride and cholesterol will also go high. So another important factor in this is insulin resistance. When the fat is accumulating, excess fat is there, the insulin level will rise, because the insulin is the component which is actually has to put the fat into storage and for the energy use. And if you are not doing, you are eating more and not doing physical activity, then it has to go for storage. When the adipose cells are filled with fat, the adipose cell says no. Then the pancreas will try to secrete more insulin, and that is the reason for hyperinsulinemia. Hyperinsulinemia, when the insulin level is going high, you will get hypertension, because the insulin has a nature to sodium retention will be there. You all know that for the hypertension, the reason is sodium. We will advise the patient first is reduce your salt. So actually the hyperinsulinemia of type 2 diabetes will give hypertension also. And there is excess fat in the liver cells and in the blood also. That is actually this triglyceride and dyslipidemia. It is because of this excess fat. There is no place to deposit, so it will be circulating in the blood. That is what we call it is a triglycerides is high and the cholesterol is high, etc.
You have been able to connect this issue of insulin, that is basically diabetes with high insulin and in the body. That is usually the situation where people are most probably taking insulin injections also. And also you linked it with their cardiovascular health also, obesity and all that, hypertension, etc. Now what we hear and see is many thin people also face the problem of fatty liver. What is it that you have to tell them? Because they say that we are thin, we don't have any fat, but we see surprisingly fatty liver in our body.
In that, two aspects are there. One is, even if they are lean, they will be having a protruding tummy. That means there is excess fat. The weight will be low or normal weight or underweight. Even underweight people also having I have seen many patients like that. So excess fat, even though their problem is their muscle and bone is not reduced. The fat is reasonably there. So one aspect is that. Next, for the underweight people having a fatty liver is because of the nutritional deficiency. See, using the fat or even the storage of the fat, we need certain vitamins and special minerals and all is needed. And if there is a deficiency, it can go for the liver damage. And that is actually many of the crash diet people, if they don't take, they will be using a low calorie diet, along with that nutrition, essential nutrition will be deficient. So the liver will not be able to process it, and there will be liver damage, cells will be damaged. So one of the most important vitamin for this, actually the concern of the liver, is the choline. Actually, we are not counted choline as a vitamin till recently, actually. And it is not supplemented also in the regular multivitamin tablets and all. Even now, there is not much of the choline vitamin is not available. Actually, it has a very important role in this protein synthesis and also in DNA synthesis and even the genetic cell division and all. It has a very crucial role. Just like folic acid, all the pregnant women, we supplement with the folic acid. No? So for this neurological damage and all, to prevent the neural tube defect in children and the congenital anomalies in children, we supplement with the folic acid. So actually, this choline also has equal role in that. And for the liver, this choline is also very, very important role. If there is not, and some of the studies are showing that congenital anomaly also, just like folic acid, this choline also is important. And liver problems, many of the liver problems, especially the pregnant women, severe liver disease can occur. In that case, especially with the PAH, hypertension, pregnancy-induced hypertension and all. So there also has a major role of the choline deficiency also is there. Actually, in India, we don't have much studies about the deficiency, but I have seen many of the American studies where how much of American people are, many of them are deficient actually in the choline. I think that actually the dietary recommendation for Americans, they have clearly mentioned that choline deficiency and all.
Most people don't realize the importance of the liver in actually what food they take, because generally speaking, it is heard that liver has a very major role in almost all foods that we consume in handling it and all. Can you shed some light on the importance of the liver so that people who, when they take food, they should realize, this food is not only being managed by my digestive system, but that digestive system, the liver's role in that is so important. So that, they will be more careful when they put something into their mouth.
Basically, actually, liver is a part of the digestive system also. Liver is actually producer of so many proteins. Almost 500 items are continuously produced in the liver, and it is according to the need of the body it is producing. And also along with that, the liver is producing digestive juice called bile. Bile is then stored into the gallbladder. And actually, this gallbladder disease, we have always hearing about the gallbladder stone, gallbladder polyp, and gallbladder cancer, etc. Actually, when the liver is diseased, the gallbladder also get diseased. Actually, the gallbladder function is to store the digestive juice produced by the liver, and then when the food is we are taking the food, it will be released. But if the composition of this digestive juice stored in the gallbladder, if it is abnormal, if it get abnormal because of the liver is not well, so that will damage the give disease to the gallbladder also. But for the gallbladder disease, polyp or the stones, we simply ignore it, the problem with the liver, and we just remove it. In the modern medicine, the gallbladder problem, remove the gallbladder. That is the easiest way out. That is, we are always thinking in that way. But it is not correct. If you remove the gallbladder also, there will be so much of problem, and the liver problems will be continuing. So, this digestive juice, along with that, this digestive juice, the excretory product also. When the major of this, whatever we take, even these vitamins and this drugs, this liver first pass metabolism is there. Almost all the drugs which you are taking over the mouth, 90% will be destroyed in the first pass metabolism itself. And that metabolic waste also is coming into along with the bile and into going into the intestine for the as an excreta. So liver role is very, very important for human. Not all the vertebrates have liver. So if the liver is damaged, that processing of the food and also the digestion can get affected.
You had mentioned earlier about the connection between the liver functioning and the other body parameters like hypertension and dyslipidemia, fat content and all that. So when you look at it, when normally a patient comes to the hospital, usually we see that they don't come initially for a fatty liver diagnosis. They come for something else. So now what is happening is that they come for multiple other issues, and then fatty liver is diagnosed on the side. So once that is diagnosed, usually the patients have a feeling, that that is something that can be managed on the side of it. While they had come for the major issue, must have been diabetes or cardiac problem or kidney problem or whatever. So why is it that, in our present context, this fatty liver is not taken seriously? Is it something that, the patients should be made aware of?
Yes, definitely. Because the modern medicine, I'm talking mainly about the modern medicine. I'm not aware of much of about the Ayurveda and other alternative medicines. In modern medicine, there's no medication actually for the liver, fatty liver, or the cirrhosis and all. Only thing what we can do is, our only medicine which is given is bile salt supplement. Supplementary bile salt. I had told you that this bile, the digestive juice is there. In a part of the digestive juice, it can be supplemented. As we know, if your thyroid hormone is deficient, we can take supplement. Just like that, if the liver is having a problem, you can take bile salt as a supplement. But no other medicine. Liver is not producing bile salt alone. Liver is producing around 500 items. So only one is this bile salt. So we have only that one item. So what we had to take care is, there is no medicine can reverse the fatty liver, but it's the lifestyle, especially excess calorie, excess carbohydrate, excess fat intake, and excess fat accumulated in the body, which can be removed only by burning it out. It's basically the fat is carbohydrate, hydrocarbon actually fat. This accumulated fat is only carbon and hydrogen. It has to be used and converted into carbon dioxide and water. Then only it can go out. For that, first thing, we have to reduce the calorie. Then only this excess calorie can be. It's only calorie actually. This fat is in the body mainly for excess fat. But fat has many functions, even protection of the body and giving shape to the body and all is there. But excess fat comes is accumulating because of excess intake and too much of energy, lack of exercise. So that has to be, you have to cut the carbohydrate and the fat and the excess calorie, and the excess which is stored has to be burnt out, simply burnt out. Actually, it has to be made into carbohydrate, it's carbon dioxide and water. And that is the only way out for that. That is not the doctor can do anything for that. Only the patient, the person can do that for that. That is why when if you are going for a scan, if you are finding out a fatty liver stage 1, doctors will not even comment about that because they don't have anything to offer for that. If it is stage 2 or 3, usually not even in the 2 stage, bile salt also is supplemented because it is not necessary. In the end stage, cirrhosis and when you are developing ascites or when you are getting symptomatic in the end stage of the liver disease, only this bile salt also will be supplemented. So the patient should be aware that if they have a fatty liver at any stage, the only one who can give help you yourself, and you have to control your food and do the exercise and make sure you are getting all the necessary nutrients also. You don't have to go for a crash diet. When you are using the diet also, you should make sure that you are getting all the nutrients in the correct proportion. Don't take some junk food and make the crash diet. But you can use the this nutrition-rich leafy vegetables and fruits, moderate fruit also in the moderate quantity. Then you will be not to have a much of the problem.
From your experience, can you share any example of any patient, and what stage the patient was and how they could manage by correcting their lifestyle?
I have seen regularly seeing all levels of fatty liver problems. Say fatty liver, no one bother actually. Only it is an incidental finding. We will be before I'm actually giving clinically supported lifestyle correction. In that, before starting the treatment itself, we'll do an abdominal scan. In that, liver is definitely assisted. I have not seen only very rarely I see a patient without fatty liver. Only thing fatty liver 1, 2 or 3 with fibrosis, 4 or fibrosis, the level of fibrosis which actually matters. So the most important thing or the positive thing is it can be reversed. Simply it can be reversed. If it is the patient is undergoing the clinically supported lifestyle correction in which we are making sure that the patient is getting all the nutrition and the calorie intake is reduced to around 650 to 700 or 800 kilocalorie per day, the patient will be able to reduce almost 10% of 20% of the body weight in 90 days, that is 3 months. And after 3 months, when we look into repeat, we'll do the repeat scan also. If it's for stage 1, the grade 1 fatty liver, it would be usually gone. If it is grade 2 or 3, it would have at least one level, it will be reduced. And I had seen even patients with 4th stage with fatty, severe cirrhosis. And really, the patient is actually understanding only the intensity, and the doctor will be saying only when that is cirrhosis is reached. Even the cirrhosis with the shrunken liver, it will grow back actually. The liver has the hepatocytes, the liver cells. The importance is actually it can divide and make you corrections, and liver can repair itself. So even the 4th stage, we can repair it, and the patient can come back actually and get to a healthy liver health can be regained.
With that, we come to the end of this first episode. Thank you for watching. In the next episode, we look at the latest and current treatments available for liver diseases and fatty liver. Thank you. The informed patient is key to treatment success.